service. Over the past 2 decades, the institution has grown into a key healthcare provider serving patients through evolving medical needs. I leave you tonight with looking back at about 20 years of Karen Hospital.
It starts like any other day. Staff walking in, patients waiting, but behind these doors are 20 years of stories. When it began, there was no guarantee it would last, just an idea and the people willing to build it.
Yeah, this hospital officially.
There are many people who were with us in the beginning and they couldn't believe. Some of my doctor colleagues decided, this place will never run. I keep telling them, and they went back to where we had come from. I meet them today, I ask them, how is Egypt? What do you mean Egypt? So we went with you to Canaan and you decided, you returned back to, you went back to Egypt. But those were the very difficult days when we began.
We started in 2006, in January, just when the hospital was opened. But there was a long story before the opening of the hospital, and that was the struggle of getting all the requirements from the land, the finances, and as well as all the requirements, for putting up a hospital.
We are a multi-specialty hospital. We have various specialties that are super specialties as well, especially in our cardiac care, in our orthopedics, gynecology, and pediatrics. We also have different levels to our healthcare achievements. One is in the actual hospital. The other one is in the satellite branches, which are located in both urban and rural areas of Kenya. And then we also have a training college, which we started almost about 13 years ago, training the Kenya registered nurses and also other healthcare professionals. Our biggest program being our registered nurse program, but also clinical officers, perfusionists, and theatre technicians.
Our initial, patients, both inpatients and outpatients, we were looking at about, in the first year, not more than 10 patients, and we've grown to a capacity of averaging 60% in inpatient, and for outpatient, we are seeing over 400 patients in the main hospital, and maybe another 200 in our branches. So in terms of growth, I think we've witnessed very, very commendable growth.
Behind every diagnosis, every treatment is a system designed for precision, speed, and better outcomes.
These machines you see for the heart surgery, there's one called the heart-lung machine. The machine that takes over the work of the heart when the surgeons are working on the heart, because the heart is not pumping. There are technicians who run that machine. It's called perfusion or perfusionist. We are, I believe, the only hospital training perfusionists in this region, because we need them for surgery. As we continue, we just look for gaps. Where are the gaps in medicine? Where can we fill? And we try to do that as much as possible. And the next 10 years, we shall try to fill more gaps in that. But at all the time, success only comes if you do it with passion and not looking for how much money you are making. We don't have to make a lot of money, but we make a lot of impact to society.
As we speak, we are ISO certified, 9001 2015 being the latest certification. That means that every department has documented their processes, and we have documented our procedures, and that has enabled even for staff to be able to work within the scoped guidelines. We've been able to also automate most of those processes. However, we still have some that remain manual because of the nature of business that we are in. And with the processes in place, that provides a uniform way of ensuring that we deliver these services across our networks, so that whether you come to the main hospital or go to the branches, then the current hospital brand remains the same.
But beyond technology, It is the human touch that defines care here.
In terms of client experience, we're very keen on client feedback. One of the things that is a value add to us as a hospital is that we call all our patients. Every person who has been admitted here at the hospital over the last maybe decade that we started the program, they get a call to ask, how are you doing? How are you faring at home? We're very keen to ensure that clients come back for their follow-up visits as well. We have also put into place various feedback mechanisms that while you're in the hospital, you're able to reach us if there's anything that you give us a compliment or even if you have a complaint. We track our turnaround time quite seriously so that we want to know as soon as you enter the facilities, from registration to the point that you get your triage to the point that you see the doctor, how long is it actually taking you to receive the services?
We have an open communication system where if there's an area that needs improvement, then they staff have the leeway to be able to bring up that issue, have a discussion, whether it's with the HOD or even be escalated, so that then those ideas that are within our teams, we're able to tap into that, because that's how we also become, evolve with time and improve on our services. Yeah.
We also have now improved quite of our operations. You see, we've improved. We already have a client experience nurse, wound specialist, and I'm really, really proud to actually say this is a center in nursing that we have developed. Look at whole the hospital, we have already training, we have research. You can actually see doctors also, they've actually gone back to school. We have fellows who are doing here, people who are doing the surgical residence. The growth is immense.
At the heart of Karen Hospital are the people, some who have walked this journey for 20 years.
It has been a good journey. When the hospital started, it started growing. When I joined the Karen Hospital, I also started growing with them. When, assumingly I was 20, now I am 30. What I was doing by then is not what I'm doing. So I have always made sure at the end of one single year, I've done something that improves my life. By
the time you can say you have at least 25 staff who are here for 20 years, I mean, it may sound like a small number, but 20 years is not a short period of time. So it's exciting to hear that there are people who are with us at the beginning and are still with us today. And that loyalty, yes, even if I ask how many have been here for 10 years, the number gets even bigger. So we have a very loyal team as well. And I feel like it's almost like a family unit here.
Being part of a homegrown institution, I think is something that I'll live to treasure. Secondly, looking at the investment that we have made in terms of healthcare, not just the equipment, but also the people that we've been able to support, and in return families, because when you employ 600 staff, the ripple effect on the family is also quite phenomenal.
The culture of motivation and the culture of empowering other people is among the things that have made me to stick here and to grow.
It has been a journey, and I'm very, very, very proud of still having served the Karen Hospital for the last 20 years.
For some, the hospital is more than a workplace. It's where most of their adult life has unfolded.
Our leaders allow us to learn, isn't it? I don't think they really control us. They follow you. They give you the freedom to do that, as long as whatever you're doing is right. For them, growth, and then why I would want to stay here, I think is the support also you get. Remember, running a business is not as easy as a health sector, isn't it? But I think they're out there to help us support with whatever efforts they are able to. So that has actually made me, and then I would want other people to grow like me. Looking at young girls and young men becoming nurses, what would I tell them? The team here is very committed. People here at the hospital go above and beyond what is, should I call, your job description, to really, take care of the patients. Many of my staff are willing to work extra hours, not because I've asked them to, but it's because they really want to be here with the patient to make sure they really get the services that they need. So commitment, I think, is the number one thing I see in the staff. The other one is the willingness to learn.
I remember there is a Major Kinyanjui who was a pilot in the wildlife. He got lost along Mount Kenya region. He was looked for some days, and he was located one time, and by good luck he was flown in here. And that time was working. I am among the staff who received him, took him to casualty. I remember I assisted in putting a line so that you can give him fluid and the care. I followed the care until the discharge. So that is one of the patients I really remember that we taken care of, and then the patient went home.
Through challenges, the mission has remained the same: to save lives and serve with compassion.
We can get the services more into people's homes, especially for people with chronic ailments or for the elderly. I think that is one of the things that we've been looking at. The other one is to look at the cash-paying patients, people who cannot afford to be under insurance, are not employed, or are not under any scheme. They are feeling the burden of having to pay out of pocket to come for the services. So how can we reduce that cost? So one of the things that we're looking to do in the next fiscal year is to create services that are purely targeting cash-paying patients, which will be then at a lower cost than the regular pricing that we give, whether it's in the pharmacy or the lab and things like that.
The number of doctors we at Karen have trained in this country are many, especially the number of cardiologists. You go into town and look for cardiologists today, maybe if not half, 50% of the heart specialists in town here have come through the Karen Hospital heart training program. We now have a formal program to train cardiologists. That's why you find that if you come to Karen Hospital, you find doctors from other areas. You find doctors from Burundi, from Kampala, from South Sudan, from the Gambia, from Egypt, coming to train here in heart diseases because it's one of the centers of training for heart diseases.
What comes next is still being written by those who are here now and those who will come after.
The partnership that we have shared with the Heart Foundation, which actually has been in existence since 1993, has been a great partnership. I think it's something that's fulfilling, that has nurtured our spirits even as a staff here, because we see the children. They come in, they're frail, and then when they're leaving, they look a bit better. Then they come in for a follow-up visit, even 3 months later, and you can't imagine it's the same child. Seeing the faces of the parents who, you could tell when they came in had sleepless nights, were so worried, were so concerned, and now are actually smiling. Mothers who, when they walked in, did not even, crack a smile, and now are smiling and are so happy. For me, I think that is one of the biggest impacts that we've been able to make in collaboration with the Heart Foundation.
Having had to travel overseas to do our cardiology program, we felt that it was important that we could train cardiologists locally and therefore remove the need to have to travel overseas for the certification.
Next year, we are starting a program of heart surgery. Again, the hospitals in this region that train cardiac surgeons are few. In fact, in the country now, I think only 1 or 2 other hospitals train cardiac surgeons. We are going to start that next year.
I'm happy to also say that we have also contributed to we are a large paying taxpayer of the community, and that's something that we should be proud of, and I tell my staff, be proud of it. We have contributed without knowing exactly where each shilling went to in terms of our corporate tax and things like that. But we have built the country in our little way as Karen Hospital. So I think we should also be proud of that. And not just me as a CEO, I'm talking about anybody who has worked for the Karen Hospital should know that we've done our part as a nation builder.
We are looking at ensuring that as much as possible, nobody will need to leave Kenya to seek healthcare services outside this country. We have invested a lot in human resource in terms of training our own staff in different specialties, so that then most of those specialist services are actually housed within the hospital. Number 2, invested in equipment so that then again, some of the procedures that people are going to get services outside there, we can be able to offer them within the country. And maybe the challenge to our supporters and even the nation at large is, let's buy Kenya and support Kenya, because this is a hospital by Kenyans for Kenyans and even beyond into the region.
20 years on, the work continues not as a milestone, but as a routine, day after day.
Happy 20th anniversary to the Karen Hospital.